I'm Erlinda, and this is Empowering Voices. We have a program for you that is going to provide you information, valuable information, so please find a pencil so that you can write the number at the end of this program. Today, we have some awesome guests. Please join me in inviting them to answer those questions that you may have that may help a loved one, a neighbor, a friend. Okay, with me I have some wonderful people. Thank you for being here.
Thank you for having us.
Oh gosh, it's our pleasure to have you here. We have today, I'm going to introduce you, okay? Terri Franklin. Now Terri, I'm going to read these initials. You have a lot of initials behind your name, and I want them known. Okay. But I also want you to tell me what they are after I'm done, okay? Okay. And we have Terri Franklin, who is an LCSW, and then MBA, CCHP. You are a DBH, Deputy Director of Criminal Justice and Juvenile Justice and Substance Use Disorder and Recovery Services. Wow, that's a mouthful. So now, we'll come back, and then you will tell us what that's all about. I'm going to go over here to Dr. Belford. Doctor, thank you for being here.
Thank you.
It's a pleasure to have you. I know your schedules are very busy. However, this is very important because we're going to tell everyone at home about this issue, okay? Now, you are a PhD, and that's why I call you doctor, and a LAADC-CAV, which is a DBH Senior Program Manager, Criminal Justice and Substance Use Disorders and Recovery Services. Now, let's go back to Terri. Terri, tell me what that's all about.
Okay, so I'm a licensed...
Short and sweet.
Short and sweet. I'm a licensed clinical social worker, so that's an LCSW. So that means that I have a master's degree in social work.
Great.
Probably about 15 years into my career, I thought I'd go back to school because, of course, that wasn't enough. And I got a second master's in business administration.
Wow.
So I have an MBA as well. And then the CCHP is Certified Correctional Healthcare Professional.
Wow. Wow, that's awesome. How many years would you say together?
Together. Well, I've been actually with the county 25 going on 26 years. And probably been in mental health about 30 years.
Wow. Yeah. So you're kind of an expert there.
I think so.
Oh, yes, yes,
to some degree.
And Dr. Belford? Yes. I just read a lot about you. So would you tell me a little bit about what those initials stand for and, you know, what you do?
Yeah, so a PhD is a doctorate in philosophy. I have a PhD or a doctorate in clinical psychology.
Wow.
Yeah, and my LAADC is actually a licensed advanced addiction counselor. Wow. And that means that I have a specialization in addiction. The other letters behind that, the 5, means it's the top level. So because I have a PhD, I tested in, and then I have the designation of a licensed advanced addiction counselor 5. So for individuals who don't know, that means that I have an advanced addiction certification.
Wow, wow. So today we are talking about substance abuse, alcohol abuse, and what exactly is alcohol, drug addiction?
Well, you know, it's a good question, and a lot of people have talked a lot about this over the years. There's been the notion that addiction is a moral issue, and as a county...
A moral issue?
A moral issue meaning that you made a decision, and oftentimes what comes with that is the stigma around, you know, you chose to use drugs, and drug addicts are bad people, and that's just simply not true. It's not the... philosophy that we as a county go by. We believe that drug addiction is a brain disease. It means that there's biological components, there's sociological factors, and genetic factors.
Genetic, yeah. Okay.
So as a department, we believe that people are resilient, that even though they may suffer for many years trying to get clean and sober, that given the right time, the right opportunity, the right circumstances, sometimes we have to be the hope that they need. They can get themselves out of that addiction and into recovery. We really believe that recovery does happen.
Okay. So if a person's been drug addicted and they've gone to let's say, to recovery agencies and admitted themselves 5 or 6 times and failed.
Yeah.
They go out again and start the drugs or the drinking. Can they still be rehabilitated?
Absolutely. From our perspective, similar to an individual who maybe has diabetes, you take insulin, you get better over time. What ends up happening is maybe that donut is sitting on the table and you take that donut, and for that moment your sugar rises and you end up in the hospital. We don't give up on those individuals, and so our philosophy as a county is that it doesn't matter how many times it takes. We're going to be there for you. We're going to encourage you. We're going to give you hope. And the small successes are really those that matter. So, for instance, someone who's gone through treatment 5 times, there's the possibility that those 5 times are the longest time they've had clean in a very long time. So we don't necessarily consider that a failure. We actually see that as a success. And so we build upon those small successes in order to make it longer and longer each time an individual comes to us, in hopes that eventually it's long term. And so our programs in the county are designed to do just that.
Okay, now I heard that an individual went as far as 40 times
Yes,
to rehabilitation, and finally,
Yes.
finally did it.
Yeah, we do a lot of evidence-based practices. So what we try to identify is for people who have addiction, how can we help them? So we have motivational interviewing, we have special programs that are proven to work with this population. And I'd say just like anyone else, for me, sometimes I want to lose that extra 5 pounds or whatever, we know what we're supposed to do, but unfortunately we don't always do it. So sometimes something just clicks. Sometimes we catch them at the right time, we ask the right question, or provide the right amount of support, and then that 41st time they're able to maintain their sobriety.
I know this sounds kind of silly. However, tell me, doctor, tell me, how do we really know if a person's addicted? There's closet drinkers, closet people that pop the pill or shoot up. How can I identify an individual?
We don't always know when an individual is addicted. We don't always know when they're using. But the best predictor is to know the person that you're around, your family member, your loved one, your friend. And if there's a change in behavior that would be their normal behavior, that maybe there's an issue going on there, and the discussion and openness with them around, hey, I have a concern.
Yeah.
And I think that's one of the biggest challenges, is feeling comfortable enough to confront the individual in a way that's loving and caring and supportive. And yet, I'm noticing some changes in you, and I want you to know there's help out there. And that's where we come in. We have an array of services, from prevention programs to outpatient programs to residential treatment and withdrawal management programs. Give them our number, ask them to call us. It's not really important for you to determine as the observer that there's an issue. It's just to give the information, open the door, and let us do that job. We're here for them. We want to be able to make ourselves available, and we don't care if it takes you 1 time or 100 times. We're going to provide services to you and your family, because we believe in the system getting the assistance they need.
That's wonderful. Now, tell me, are women just as susceptible to substance abuse and drugs, alcohol? Are women in a higher rate than the men, or?
In our county, men are about 56% more apt to seek treatment. It doesn't mean that they're more susceptible, it just means they're coming to treatment more frequently than women. Our women numbers are a little bit lower than that, about 48%. But there's other barriers for women that often keep them from coming to treatment, like children, worried about a family member that they need to take care of, or maybe they're with their significant other and they don't want to leave that individual. So we do have, again, programs in our county that are designed to bring women with their children into.
Oh, really?
Absolutely.
The children too?
Yeah, we have
Absolutely.
perinatal programs that do address the needs of the women, pregnant women, women with children. We also have programs that will work with fathers and fathers who have their children. So we have a wide variety. As a department, we have a variety of services.
That's fascinating, that you do help the children and bring them in too.
Yeah.
That's wonderful. Now, however, you mentioned pregnant. If she's pregnant and drinking or doing drugs, that affects the child.
There's
The baby.
particular protocols, and our providers who we contract with, and even our county programs who provide particular medication-assisted treatments to focus on specifics around an individual who might be pregnant, are absolutely competent in those areas, and we trust that they're going to do the right protocols and ensure that those women who are pregnant are taken care of medically the best way possible.
I see. I see. Do you want to add anything to that?
No,
You're
I would
comfortable
agree
with that,
That's
yeah.
a good
Good.
response.
That is surprising to me. You know that you do. Now, do you have in-house treatment and outpatient treatment?
So we do have residential treatment. So we have withdrawal management, or detox is what it used to be called. And so basically that's when the substance has impacted the body physically to a level that if we don't slowly withdraw them from that substance, then they can get really sick or have a lot of pain. So it's a more measured way of helping them to come off the medication, or not the medication, the substance, and then we can transition them into residential where they can stay longer and actually start learning how to deal with being without a substance. I mean, a lot of times people get used to having that substance in their body, so it feels a little odd when suddenly they don't have the, opioid or the alcohol or whatever. So it's a continuum of care. We really like to see it as a continuum of care. So we try to transition them from the highest level down to residential and then eventually into intensive outpatient if that's what they need, or outpatient services.
Well, in transitional care, you actually sometimes have to give them medication to get them
Exactly.
through
'Cause
the detox.
Right. I think in the old days it used to be kind of pull yourself up by your bootstraps and suffer through it. We don't have to do that. There are medications out there now that help ease a lot of the discomfort and the pain, because we don't want you to suffer. We want you to come off the substance and start to work towards your recovery. So yeah, there are med-assisted treatment as well, is what we call it.
Right. So what happens when a person calls in, needs help, is invited to come in? You make the decision as to what step they're in, what they need?
So what happens is, at the County of San Bernardino, there actually is no wrong door. You can walk into any of our outpatient treatment programs, even a residential treatment program, if there's one in your area or your neighborhood. Even our mental health clinics are able to connect you to, we have a centralized system that conducts assessments. In our outpatient programs, any of the outpatient providers can do the initial assessment, but the assessment is done to determine level of care, and that's based upon the new rules. The Medi-Cal waiver, which is passed a couple of years ago, is something that allows us to treat more individuals and individuals who are Medi-Cal eligible, and so we do have to follow certain protocols.
right.
Yeah, and so that assessment determines the level of care, whether it be outpatient, withdrawal management, prevention services, whatever the degree, and then we assist in navigating them to those services.
Okay, one of the ideas or thoughts that came to my head was intervention care. Is there such a thing in the programs that you have? For instance, can a family member call in and say, my brother is this or my mother is this? Can you come get her?
We do have some of our residential programs that do provide intervention care. So they will work with families and meet with them, and if they have to meet with a loved one, they can do that as well. I'm not sure that all of them provide it, but I know we have a few that do provide that service.
Most of the programs that we have, even in the outpatient settings, have licensed therapists that are employed. They have certified substance abuse counselors, and so at any level they could bring in family to assist the family in managing. We see it as it's a systemic issue, so we want to treat and assist everyone in that system, because oftentimes what happens is the individual who's using is identified as the problem, but when that individual changes, the family doesn't change and the individual can be more apt to relapse at that point.
The family dynamic.
So what we do in our programs is try to assist, educate, and facilitate the entire family in the process of change. It's a process that everyone can participate in, and we want to support that as a county. And so our programs do support that. Now, if an individual calls in and says, my brother or sister has a issue that we're concerned about, we absolutely would talk to them. It's really important that we talk to the individual, however, because those who have substance abuse issues or concerns are protected by federal law. So we don't share that information when it's shared with us by that individual unless they give us permission to do so.
Right, okay. Now, here in California and other states, there is a legalization of marijuana. Okay, is that addicting? Can you be addicted to it?
So our stance is whether it's addictive or not, it doesn't really matter. If it creates problems in an individual's life, we're here to help you. So our stance wouldn't be either way. We know people are using. We do see an increase, particularly in our youth population. We serve those who are 12 and up. So there has been an uprise, but we're here to educate through our prevention programs about what that means, using vape cigarettes in order to smoke it.
Do you go into high schools? That's a very important area.
We absolutely do. We partner with Public Health, who has a program called Friday Night Live.
Wow.
And that program is made up of students who not only facilitate throughout the school the education process, but they also bring back information for us so that we know where to target and who to target and what substances and concerns that we should have in that particular age group.
Right.
And I would say, if I could just add to that,
Sure.
that
Tell me.
recently we did identify our youth as a population that we do want to do more outreach with, because what we've noticed as we look across our system of care, that for whatever reason we don't have as many youth coming into treatment, and we're sure that there are issues out there. So as part of sort of a quality improvement program for our department, we're going to be looking at how to engage those youth. And we recently had a Recovery Happens event, and we had probably between 2,000, 3,000 families and kids and youth there. And so it really kind of highlighted, it's a good thing that the youth are here. That was a good opportunity. We probably could have taken to kind of do a poll and say, okay, how can we reach you? But we did reach out to a few of them from local high schools, and they said they think the peer-to-peer. So we're thinking, well, maybe we can start to train peers that can reach out to the youth, as opposed to me as, you know, an administrator with the county department. But if we can identify those youth who can go out and send the message, that might be another way to reach them.
I see. And you also go into colleges and plays. I understand you have plays for the students. You know, that's a population too in the colleges that is, you know, you may not even know that that person has an issue. And trying to study and you want to help them as well.
You know, September is Recovery Month, and so part of our Recovery Month is bringing in, we partner with an agency out of San Diego this last play period, and we had a play that was very impactful, I thought. It highlighted a lot of the issues around substance use and alcoholism, and so we also had a panel afterwards that spoke. I was part of that panel. The beautiful part of that was it was on a college campus at Valley College, so our local college. And after the play, there were so many people that came up and really wanted to tell their story that maybe they otherwise wouldn't have had an opportunity to tell. So we will be doing more of those events every September, so you can look forward to that.
And actually, I'm going to tell the public, I was there and I saw you on stage.
Yeah, I like to be on stage.
You were wonderful. And that play, you know, and after the panel discussion, when the men or the women stood up and said that they, you know, had been rehabilitated. It was so awesome. It was really, you know, they had really had hard times in their life.
And there's stories we hear every day. You know, it's not an easy process. It's a huge commitment. It's a lot harder to get clean than it is to use. And so, you know, it's really important that people know that it does happen. Recovery does happen.
Right. And it affects the entire family.
Absolutely.
Because it could be the money for the groceries, it could be the money for the light bill, money for the car payment, the house payment. You know, I've heard stories where people actually lose their homes.
Absolutely.
You know, I didn't realize that
It's a chronic,
drugs were that
Yeah.
expensive.
Yeah.
chronic relapsing condition.
Right,
so.
right. So the programs that you have are phenomenal, you know. And again, I'm going to say the phone number is going to be on at the the end of the program, because we really want the public to realize that you are there
Yes, we are.
and that they can get help to be rehabilitated, be individuals that are self-sufficient, independent, cut off the ties with the drugs.
Yes, and health and wellness is a huge piece of that. We want to address the whole person, their families, and get them better.
And the other thing I wanted to add on behalf of our department is that we do hire people who have a history of substance use, because what we find is that sometimes somebody who's walked in those shoes is one of the best people to mentor somebody who's going through it now.
Absolutely.
So we're hiring people who are going to be following them as they transition through the residential process. We have people that go into the jails who are, we call them peer and family advocates, who go in and help support people as they're trying to transition out of the jail, but also into the community and into their recovery.
That's right. So the individual that is observing, watching the one that has already been rehabilitated, says, if he can do it, I can do it too.
Absolutely.
Because, say, Joe over here, he's had it for 4 years and he cleaned up.
Yeah, exactly.
So I can do it too.
Yeah.
You know.
Sometimes we have to be the holder of that hope. We have to be the one to hold on to the hope for them until they have hope for themselves.
Right. Has there been I know we're not going to talk names, but a situation that really impacted your life here in this job?
Gosh, there's so many. I mean, I've been doing this over 22 years.
Oh, yes.
And there's story after story. I can tell you most recently a situation that occurred. An individual who was released from prison, had been out for quite some time, didn't really get resources. They give him $50 or $200 and maybe a transitional place to stay. But ended up out on the street, turned up at one of our clubhouses, which is a mental health program for individuals to kind of come in and stay busy during the day. There's a lot of activities.
But at night, where do they go?
He was sleeping around the corner, and what he did was he was sitting out, and he wouldn't leave the parking lot, and the staff, who are very tuned, said, hey, what's going on? And noticed that he had a bottle in his hand full of pills, brought him in, called Ms. Franklin, who called me, and I ended up over there, and through coordination of care and our entire system, we were able to get this person to turn in the medication that I think perhaps he would have taken otherwise and maybe not been here today. A very fast transition to a crisis stabilization unit, which our county also has available. Wow. And then into residential withdrawal management the very next day. We got a phone call yesterday. The individual is still in treatment, doing very well.
Wonderful.
And can't wait to come and see us in person again, because I'm sure his first day with us, he probably doesn't remember what we look like, but he's still there, and it's wonderful. Those are stories we hear every day.
That's wonderful, to see individuals be rehabilitated, going out in public again, being individuals who are self-sufficient.
And just having treatment support, and the staff at the county, including county staff, but also our contract providers who believe in them, who are there for them, and hold the hope when they can't.
Right, right. So you have a great team there.
Yes.
And it's wonderful and phenomenal that you exist. Our people that are in substance abuse situations, drug abuse situations, alcohol abuse situations can be rehabilitated. So people at home need to know that your group exists.
Yes.
And how long has this group existed?
Well, the county of San Bernardino has been here for quite a while. I'm not sure, substance use.
Many years.
Yes, many years. I can't
Many
put a
years.
number to it.
Well, when we started this show today, you guys were a little worried about, time and a little nervous. Someone wanted a tan. Someone wanted 10 pounds up, which was me.
And me, I'll admit it.
And but we had a good time telling folks at home that people can be saved from this situation. So we're closing. So please give me a quick thought.
A quick thought, don't give up.
Don't give
It's never too late.
Right.
Don't give up. Keep going. No matter how many times you've tried, keep trying.
Absolutely.
And we're here for you.
How about you, Terry?
Me, I would say recovery happens. We just need to believe that recovery does happen, and don't give up, be resilient. You know, we have resources out there, reach out to us and we'll be glad to help.
Wonderful. Now, people at home, remember, there is hope. There is a reality that drug addicted, alcohol addicted individuals can be rehabilitated. The county of San Bernardino, the Inland Empire, the desert areas, they have facilities that can help. As you saw, these two individuals today are phenomenal. So please, I want to say thank you for watching us today. We had fun. And until next time, I'm Erlinda. Take care.